Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that sheds light on the management of seizures in our feline companions. Epilepsy, a condition characterized by recurrent seizures, is a common neurological issue affecting an estimated 1 to 2% of the general domestic cat population. Antiepileptic drugs form the cornerstone of treatment for this condition. While phenobarbital has long been considered a safe and effective initial anti-seizure medication for most cats, there are instances where it may not be well tolerated or where it fails to adequately control seizure activity when used alone. In the canine world, potassium bromide serves as a viable alternative or additional antiepileptic drug. However, its use in cats is associated with significant adverse reactions, including allergic-like pneumonitis, occurring in a substantial proportion of cases, making it a less desirable option. This highlights a critical gap in our knowledge and the limited evidence-based recommendations for selecting antiepileptic drugs beyond phenobarbital for cats. Unlike in dogs, there isn't a clear consensus on the best approach for managing feline seizures when first-line treatments are insufficient. Therefore, further research into the efficacy and safety of alternative antiepileptic medications in cats is essential. One such medication that has garnered interest is Zonisamide. Approved in the United States and Europe as an additional antiepileptic drug for treating focal seizures in adult humans, Zonisamide has also been used in veterinary medicine to manage seizures in cats, although primarily based on anecdotal evidence. While studies in animal models have demonstrated its effectiveness in controlling both focal and generalized seizures, and clinical trials in dogs have shown promising results as both a standalone and add-on therapy, research specifically evaluating Zonisamide for seizure control in cats has been scarce. Although clinical observations suggest that Zonisamide is generally safe and well-tolerated in cats, its actual effectiveness in reducing seizure frequency and the prevalence of any associated adverse effects in cats experiencing seizures have not been firmly established. This brings us to the core of the study we are discussing today. The primary objective of this research was to look back at the medical records of cats with epilepsy who had received Zonisamide as part of their seizure management. The researchers aimed to evaluate whether there was a significant change in the frequency of their seizures after starting Zonisamide treatment. They hypothesized that cats with epilepsy treated with Zonisamide would experience a notable decrease in how often they had seizures. A secondary aim of the study was to specifically analyze the seizure frequency in a subgroup of cats that had been diagnosed with idiopathic epilepsy, meaning epilepsy with no identifiable underlying cause. Furthermore, the study sought to carefully document any clinical or laboratory detectable adverse effects that these cats experienced while on Zonisamide therapy. To conduct this investigation, the researchers meticulously searched the medical record systems of 2 veterinary medical centers for cats that had been prescribed Zonisamide between January 2010 and December 2020. They focused on cats under the care of board-certified veterinary neurologists who had a history of recurrent seizures and had been treated with Zonisamide for at least 3 weeks. Cases with incomplete information regarding seizure frequency or Zonisamide dosing were excluded to ensure the reliability of the data. In total, 57 cats met the criteria for inclusion in the final analysis. The study gathered comprehensive data for each cat, including their age at the onset of seizures, sex, breed, weight, any definitive diagnosis for their seizures, all diagnostic tests performed, their age at the last follow-up, and the cause of death if applicable. Information from blood tests, imaging studies like radiographs and magnetic resonance imaging, cerebrospinal fluid analysis, infectious disease testing, and surgical biopsies were also reviewed when available. For cats where no underlying cause for the seizures could be identified through these advanced diagnostics, and their magnetic resonance imaging of the brain and cerebrospinal fluid analysis were normal, they were classified as having confirmed idiopathic epilepsy for a specific subgroup analysis. The medication data collected included the start date of Zonisamide, the dose and how often it was given, any adverse effects reported by the owners, follow-up blood work results, and details of any other antiepileptic drugs the cat was receiving concurrently. The researchers also gathered detailed information about the seizures themselves, such as whether they were generalized, affecting the whole body, or focal, starting in one area, if the cat experienced clusters of seizures, and the average monthly seizure frequency before and after starting Zonisamide. Seizure frequency was recorded both as the number of seizure events per month and the number of seizure days per month to account for instances where a cat might have multiple seizures on the same day. The longest available follow-up information after starting zonisamide was used to collect the seizure frequency data, with an average follow-up period of just over 1 year. The primary measure of how well zonisamide worked was the change in monthly seizure frequency and the number of seizure days per month, both in terms of the actual number and the percentage change before and after starting the medication. This was assessed for all 57 cats, and then specifically for the subgroup of cats diagnosed with idiopathic epilepsy. The researchers also calculated the percentage of cats that showed a positive response to zonisamide, which they defined as a greater than 50% reduction in their seizure frequency. The secondary focus was on documenting the frequency of any clinical and laboratory-detected adverse effects that occurred after the cats started taking zonisamide. Additionally, the study compared cats that were receiving other antiepileptic drugs along with zonisamide to those that were only receiving zonisamide. Now let's turn to the results of this important study. Across all 57 cats included in the analysis, the researchers found a statistically significant median decrease of 1 seizure per month after they started receiving zonisamide orally. Similarly, there was a statistically significant median decrease of 1 seizure day per month in the overall group of cats following the administration of zonisamide. When looking at how many cats responded to the treatment, meaning they experienced a greater than 50% reduction in their monthly seizure frequency, the response rate was 62%. When the researchers focused specifically on the subgroup of cats with confirmed idiopathic epilepsy, they observed even more pronounced reductions in seizure activity. In these 16 cats, there was a statistically significant median decrease of 1 seizure per month after starting zonisamide. Furthermore, the number of seizure days per month in this idiopathic epilepsy subgroup showed a statistically significant median decrease of 2 days. The percentage of cats with idiopathic epilepsy that responded to zonisamide, based on the more than 50% reduction in seizure frequency, was approximately 69%. The study also examined the effectiveness of zonisamide based on whether it was used as the sole antiepileptic medication or in combination with other anti-seizure drugs. In the 24 cats that received zonisamide as the only antiepileptic drug, there was a statistically significant median decrease of 1 seizure per month and a statistically significant median decrease of 1 seizure day per month. The response rate in this group, defined as a greater than 50% reduction in seizure frequency, was 70%. In contrast, the 33 cats that received zonisamide concurrently with other antiepileptic medications also showed a statistically significant median decrease in seizure frequency of 1/2 of a seizure per month and a statistically significant median decrease of 1 seizure day per month. The response rate in this group was 56%. The study also meticulously documented any adverse effects observed in the cats after they started zonisamide. A total of 15 out of the 57 cats experienced at least one adverse effect that was not present before starting the medication. The most commonly reported clinical adverse effects included a decrease in appetite or hyperexia, which occurred in 17% of the cats, and sedation, also in 17%. Ataxia, or uncoordinated movement, was noted in 11% of the cats, and vomiting was reported in 5%. The duration of these adverse effects varied, with decreased appetite lasting from 1.5 days to 4 weeks, sedation lasting 2 to 4 weeks, ataxia lasting 2 to 4 weeks, and vomiting lasting from 1 day to 2 weeks. In one cat, the decreased appetite persisted until zonisamide was discontinued. Regarding laboratory changes, complete blood counts were available for 11 cats after starting zonisamide. No significant abnormalities were found in 6 of these cats. A mild non-regenerative anemia, a decrease in red blood cell production, was noted in 3 cats, and this was similar to their blood counts before starting zonisamide. One cat developed a new mild non-regenerative versus pre-regenerative anemia, and another cat showed new signs of increased platelets and decreased lymphocytes, which was suspected to be related to an underlying systemic disease. Serum biochemistry panels, which assess organ function, were available for 27 cats before and after zonisamide treatment. 6 cats showed mild increases in liver enzymes, indicating some changes in liver function. 2 cats developed mild metabolic acidosis, a condition where the body produces too much acid or the kidneys are not removing enough acid. Moving on to the discussion of these findings, this retrospective study provides evidence supporting the use of zonisamide as a seemingly effective alternative or add-on therapy for managing seizures in cats. The overall response rates, ranging from 56 to 77% depending on the group, are comparable to the efficacy seen in zonisamide studies in dogs. The study clearly demonstrated a statistically significant reduction in seizure frequency in cats after they started receiving oral zonisamide compared to their seizure frequency before treatment. Historically, research on antiepileptic drug effectiveness in cats has primarily focused on phenobarbital, with fewer studies evaluating newer medications like imipitoine and levetiracetam. While phenobarbital remains a valuable first-line treatment, the need for additional effective drug options is evident for cats that cannot tolerate it or whose seizures are not adequately controlled by it alone. Furthermore, while potassium bromide is an option in dogs, its high rate of adverse reactions in cats makes it largely unsuitable. This underscores the importance of investigating the efficacy of other antiepileptic drugs in the feline population. Zonisamide exerts its anti-seizure effects through multiple mechanisms of action, including inhibiting certain channels in nerve cells and influencing the signaling of inhibitory neurotransmitters in the brain. It also has antioxidant properties and weakly inhibits an enzyme called carbonic anhydrase. These diverse mechanisms may contribute to its ability to control seizures to varying degrees in different cats with different types of epilepsy. Epilepsy in cats can have various underlying causes, including idiopathic epilepsy, structural abnormalities in the brain, and reactive seizures triggered by other health issues. Seizures themselves can manifest in a wide range of ways, from subtle focal seizures to classic generalized tonic-clonic seizures. The multifaceted action of zonisamide might explain why it can be effective in different subsets of cats with epilepsy. The researchers suggest that future studies should further investigate the potential of zonisamide in controlling seizure activity in specific groups of feline epileptics, considering both the underlying cause of their epilepsy and the characteristics of their seizures. Interestingly, only a small number of cats in the study experienced an increase in seizure frequency after starting zonisamide. This was somewhat expected, as a proportion of cats with epilepsy do not respond well to any medication, a condition known as drug-resistant epilepsy. Despite this, the study still found statistically significant decreases in seizure frequency overall. The fact that only 56% of cats receiving zonisamide as an add-on therapy responded highlights the challenging nature of managing seizures in cats that require more than one medication. The low incidence of adverse effects observed in the study aligns with previous limited reports on zonisamide use in cats, which also noted sedation, uncoordinated movement, and gastrointestinal upset. However, the duration of these side effects in the study was longer than anticipated, lasting up to 2 to 4 weeks in some cases. Given that zonisamide has a half-life of approximately 33 hours in cats, it should typically reach a steady level in the body within about a week. This suggests that clinicians should inform owners that sedation, uncoordinated movement, and gastrointestinal upset might take several weeks to resolve after starting zonisamide in cats. The study's analysis also indicated a trend towards more frequent adverse effects with a more frequent dosing schedule, every 12 hours compared to every 24 hours. Although this finding was only weakly statistically significant and did not appear to strongly improve seizure control. This suggests that starting zonisamide with a once-daily dose might be a reasonable approach. The mild increases in liver enzymes seen in some cats and the mild metabolic acidosis in 2 cats after starting zonisamide are noteworthy. The metabolic acidosis is likely due to zonisamide's known property of inhibiting carbonic anhydrase. Importantly, none of the cats in the study developed anticonvulsant hypersensitivity syndrome, a rare but serious reaction that has been reported in 1 cat receiving zonisamide. Overall, the researchers concluded that the frequency of laboratory abnormalities was low, although they acknowledged that larger studies with more complete follow-up blood work are needed to fully understand the prevalence of potential adverse effects. The researchers also acknowledged several limitations of their study. A major limitation inherent to retrospective studies is the reliance on information already recorded in medical records, in this case, primarily client-reported seizure frequency. Owners' accounts of seizure frequency can be subjective and potentially unreliable. Studies in dogs have even suggested that owners might underreport the actual number of seizures. This reporting bias could be further influenced by a lack of standardization in how owners were asked about seizure frequency. They might recall periods of increased seizure activity more readily, potentially inflating the reported frequency, or they might miss seizures that occur when they are not directly observing their cat, leading to an underestimation. Additionally, the time periods over which seizure frequencies were evaluated varied between clients due to the retrospective nature of the study. Furthermore, the placebo effect, where a perceived treatment can lead to improvement even if it has no direct pharmacological effect, has been shown to influence client-reported seizure frequency in canine epilepsy trials. And this could also be a factor in feline studies relying on owner reports. The researchers note that relying on client-reported seizure frequency will likely remain a limitation in veterinary epilepsy research until electroencephalography, a more objective measure of brain activity, becomes more widely used in veterinary medicine. Other limitations of the study include the variability in other antiepileptic drugs that many cats were concurrently receiving, such as phenobarbital and levetiracetam, as well as the differences in the dose and frequency of zonisamide used across different cases. The concurrent use of other medications could certainly influence seizure frequency, but it also reflects the real-world challenges of managing seizures in individual patients. However, by analyzing subgroups of cats receiving zonisamide alone and those receiving it with other drugs, the researchers aimed to better understand the effect of zonisamide itself. Similarly, the variations in zonisamide dosage and frequency could have impacted seizure control. Lastly, the response to zonisamide might differ in cats with different underlying causes of their epilepsy. And this study did not have a large enough number of cats with specific confirmed diagnoses beyond idiopathic epilepsy to analyze these differences in detail. Another potential source of bias was the variable time between a cat's first seizure and the start of zonisamide treatment, especially in cases where other antiepileptic drugs were being used. Information about when previous medications were stopped or how well owners adhered to treatment plans was also often incomplete in the medical records, which could introduce further variability into the study. Despite these limitations, the researchers emphasize that these variations reflect the practical realities of managing seizure patients in a clinical setting, and they were still able to observe significant differences in seizure data before and after starting zonisamide. They recommend that the results of this study should be interpreted within the context of the study sample, and they highlight the need for randomized controlled clinical trials in the future to provide stronger evidence that can be more broadly applied. Further prospective clinical trials are warranted to determine the most appropriate dose and frequency of zonisamide for cats with epilepsy, as well as to definitively establish its effectiveness both as a standalone treatment and as an addition to phenobarbital therapy. In conclusion, this retrospective study indicates that monthly seizure frequency was significantly reduced after administering zonisamide in a group of cats with epilepsy. While adverse effects such as sedation, uncoordinated movement, and gastrointestinal upset were observed, they were mostly temporary, although they could take several weeks to resolve. The findings suggest that zonisamide can be a valuable alternative or adjunctive therapy to other antiepileptic drugs like phenobarbital or levetiracetam for controlling seizures in cats. However, the researchers emphasize the need for additional prospective studies to pinpoint the optimal dose and frequency of zonisamide in different populations of cats with epilepsy. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.